Chapter 6, Infection Prevention. Learning Objectives. As a result of successfully completing this chapter, readers will be able to 1. Explain the role of central service in the prevention of healthcare-associated surgical infections. 2. Explain the principles, practice, and importance of personal hygiene and attire, including personal protective equipment. 3. Identify the hazards of bloodborne pathogens and how Occupational Safety and Health Administration's requirements impact personal safety. 4. Explain the rationale for the separation of clean and dirty and the environmental requirements for maintaining that separation. 5. Discuss the chain of infection and the technician's role in breaking that chain. Introduction. The central service professional plays a significant role in the prevention of surgical site and healthcare associated infections, or HAIs. When the importance of this role is understood, technicians recognize that their work practices can mean the difference between a patient's successful surgery or hospital stay and a negative outcome that could lead to infection or possibly death. Central service process. Every step or process in the central service department is carefully designed to prevent poor patient outcomes. Poor outcomes can be traced to many factors, including the condition of instruments, trays, and other medical devices that are processed in central service. In the most simplistic terms, central service supports infection prevention by the following: cleaning contaminated medical devices to make them safe for handling and prepare them for biocidal process, inspecting instruments to help ensure they are safe and functional, assembling and packaging instruments in a manner that facilitates the method of sterilization chosen and provides a barrier after sterilization, selecting and properly using the sterilization of high-level disinfectants, HLDs, which is the method for each medical device, safely storing items until they are needed and delivering them using methods that protect the integrity of the sterile packages. While those tasks may appear easy, there are several steps to each process. Each requires attention to detail, understanding of specific protocols and process parameters, and understanding of each medical device's manufacturer instructions for use, or IFUs, and the dedication to the processing of each item exactly as stated in those instructions for use. Every medical device not processed according to the manufacturer's instructions for use has the potential to cause infection in both the patient and healthcare worker. Cause for concern. In 2011, the Centers for Disease Control and Prevention, the CDC, reported that approximately 1 of every 25 hospitalized patients, or 722,000, contracted a hospital-acquired infection. One of those approximate 722,000, about 75 patients died during their hospitalization. Many of these infections may have been preventable. A surgical site infection, or SSI, is an infection that occurs after surgery in the part of the body where the surgery took place. As many as 3 of every 100 surgical patients develop these infections per year, according to the CDC. Approximately 51.4 million surgical procedures are performed in the U.S. annually, the CDC reports. Each involves the use of medical devices or instruments that have contact with a patient's sterile tissues or mucous membranes. Infection is a major risk in all those procedures. Additionally, a growing number of microorganisms are becoming resistant to antibiotics or are naturally difficult to control. Many of these microorganisms may be easily transferred to the other surfaces and people. Controlling these microorganisms and preventing their transmission is the #1 responsibility of the CS department. Infection prevention principles and practices are based on knowledge of the nature of the characteristics of disease-producing microorganisms. This includes an understanding about how they are transmitted in the healthcare environment and their place in the chain of infection. The more CS technicians know about microorganisms, the better equipped they are to prevent the spread of these organisms. See Figure 6.1, which identifies the top hospital-acquired infections causing pathogens as identified by the CDC, Center for Disease Control. Definition: biocidal, process or ability to kill or control the growth of a living organism. For more information on hospital-acquired infections, you can go to www.cdc.gov/hospital-acquired infection or HAA/organisms. More definitions: surgical site infection, SSI. An infection that occurs after surgery in the part of the human body where the surgery took place. Chain of infection. A way of gathering the information needed to interrupt or prevent the infection. Each of the links in the chain must be favorable to the organism for the infection to continue. Breaking any link in the chain can disrupt the infection. Which link is most effective to target will depend on the organism. Protection from pathogens. The origins of isolation precautions date back to the days of quarantine, a control measure used in infectious disease epidemics in earlier times. In the 1970s, the CDC established the first practical recommendations for the isolation technique. The new recommendations categorized infections in communicable diseases based upon the likely mode of transmission. To protect healthcare staff and patients from infectious diseases, standard precautions were adopted. The basis of this is to treat all human blood, bodily fluids, and other potentially infectious materials as infections. Standard precautions drive the infection prevention and control procedures that CS technicians must use because they are exposed to contaminated instrumentation and equipment. Failure to wear the appropriate personal protective equipment, or PPE, increases the individual's risk of acquiring an infection. The primary purpose of the CS department is to stop the spread of disease-producing microorganisms to patients from instruments and other medical devices. CS technicians must ensure that items used in patient care, including instruments, utensils, supplies, and equipment, are made safe by either disinfection or sterilization. Chapter 4 addressed microorganisms, how they live, grow, and are transmitted from person to person and place to place. This chapter addresses how CS professionals control the spread of microorganisms and prevent infection. Understanding asepsis in healthcare is an important piece of the basic knowledge required to work in the Central Sterile Department. Principles of asepsis. Asepsis can be defined as the absence of microorganisms that cause disease. Aseptic technique includes any activity or procedure that prevents infection or breaks the chain of infection. There are two types of aseptic technique. Medical asepsis, clean technique. Procedures performed to reduce the number of microorganisms to minimize their spread. Examples include hand washing and the decontamination of equipment. Surgical asepsis, sterile technique. Procedures to eliminate the presence of all microorganisms and or prevent the introduction of microorganisms to an area. Or, as an example, sterilization of an instrumentation and techniques performed in the operating room prevent the contamination of sterile instruments and supplies. Definitions. Asepsis, the absence of microorganisms that cause disease. Aseptic technique, an activity or procedure that prevents infection to break the chain of infection. Asepsis, medical asepsis, clean technique, procedures performed to reduce the number of microorganisms and minimize their spread. Asepsis, surgical asepsis, surgical technique, procedures performed to eliminate the presence of all microorganisms and or to prevent the production of microorganisms to an area. The 5 basic principles of asepsis. Principle 1. Know what is dirty. Items that have been used for patient care are considered contaminated. An item is considered to be either contaminated or non-contaminated for the CS technician. For the CS technician, the terms dirty and contaminated mean the same thing. Microbial contamination cannot be seen with the naked eye. However, it can be present even when it is not seen. Examples of contaminated items include open surgical instrument trays, IV pumps, and suction machines. Principle 2. Know what is clean. Cleanliness is the basic of aseptic technique. Mechanical cleaning removes soil and most microorganisms. Any item that has been properly cleaned via manual or mechanical means is considered clean. If that item has been cleaned with detergent, disinfectant, or a thermal decontamination process, it is considered clean and decontaminated. The physical task of washing, cleaning, removes soil and most microorganisms. Principle 3. Know what is sterile. Sterility is defined as the absence of all microbes. Sterility is impossible to see with the naked eye. One cannot look at a specific item and determine its sterility. Absence of microbes can only be achieved by use of steam, ethylene oxide or E2O, or sterilization methods. Principle 4. Keep the 3 conditions separate. There must be separation between dirty, clean, and sterile, in these areas to allow a margin for safety. Clean or decontaminated items must not come in contact with dirty items. If sterile items come in contact with non-sterile items, they must also be considered non-sterile. Sterile items should not be stored near sinks or in any location where there is a risk that they will become wet or soiled. The presence of moisture allows the passage of microorganisms through wrappers, resulting in contamination of sterile supplies. Principle 5. Remedy contamination immediately. When dirty, clean, and sterile areas or items have not been separated, the situation must be corrected immediately. One who observes a procedure that has as much of responsibility for maintaining proper aseptic technique as the person who performs the actual procedure. There are times when only a CS technician will know or suspect that something may be contaminated. For example, when something is dropped on the floor. Even though processing the item may result in more work, this must be done to protect the patient. A careless attitude may lead to an increased risk of infection, so CS professionals must always be aware of their actions. By adhering to the principles of asepsis, the risk of infection will be reduced for patients and facilities employees. The responsibility of CS technicians to provide safe items for use should never be compromised. CS professionals must assume several important responsibilities in their facilities' infection prevention and control efforts. The infection prevention and control goals of the CS department are as follows: to eliminate or destroy all potentially infectious contaminants present on reusable instruments and equipment, to safely distribute reusable and single-use items required for the delivery of patient care, and to establish and enforce standards for decontamination, disinfection, and sterilization in various healthcare settings. The importance of these responsibilities is clear. The use of medical devices that have not been properly handled, disinfected, or sterilized can cause infections in patients and staff. CS professionals are responsible for providing safe items that support good patient outcomes. Personal hygiene and attire. Preventing the spread of microorganisms and maintaining appropriate environments for clean and sterile items requires good self-management skills. Hygiene and adherence to dress code protocols are critical components of infection prevention in the CS departments. Personal hygiene. Hand hygiene. Hand hygiene is a term that means either hand washing or using an appropriate approved aseptic hand rub, such as an alcohol-based product. Hand hygiene is considered the single most important factor in reducing infection. Hand washing refers to the use of soap, water, and friction to wash one's hands. Effective hand washing consists of wetting, soaping, lathering, and vigorously rubbing one's hands together, making certain the lather between fingers and around the nails for at least 20 seconds. Washing should be followed by rinsing with running water and thoroughly drying with a disposable towel. See figure 6.2 for an example of this. Hand sanitizing refers to the use of an alcohol-based gel or foam. Alcohol does not kill some highly infectious bacteria like C. difficile and some foodborne pathogens. Therefore, hand washing is critical before and after any meal and before and after using the restroom. Definition: hand hygiene. Hand hygiene is the act of washing one's hands with soap and water or using an alcohol-based hand rub. Hand washing should be done prior to starting work, upon entering or leaving the work area, before and after eating or using the restroom, or whenever hands become soiled or contaminated. Infection control and prevention experts recommend that hands be washed immediately and thoroughly if they become soiled with blood, bodily fluids, secretions, or excretions. After coming in contact with contaminated items without visible soil or after gloves are removed, and alcohol-based hand rub should be used according to the manufacturer's recommendations. Approved hand lotions may be used after hand washing to keep the skin healthy and to minimize skin irritation and excessive drying. CS departments are equipped with hand washing sinks conveniently located for easy access. CS technicians should wash their hands only in dedicated hand washing sinks, not in those used for decontamination purposes. Because fingernails harbor microorganisms, they should be kept clean and not extend beyond the fingertips. Long nails also increase the risk of tearing gloves. Fingernail polish should not be worn in the CS departments because nail polish may chip and fall into an instrument set. Artificial nails should not be worn in CS departments because they also harbor microorganisms and may detach and fall into the instrument tray unnoticed. Infection prevention begins at home. Personal hygiene is important for the prevention of infections. Bathing and shampooing regularly, wearing clean clothing, and practicing good hand hygiene prepare CS professionals to continue this practice in the healthcare facility. Personal hygiene and personnel with open or weeping wounds or excessive skin irritations should refrain from handling any patient care equipment until the condition is resolved or medically evaluated. Attire. CS professionals must wear attire specific for the area in which they work. This protects the employee and other staff members, patients, and the public. Attire should be clean, provided by the facility, and not worn outside the facility. Technicians should change out of their street clothing worn at home, and shoes, and into scrubs and shoes kept at the facility. Usually there will be a locker space for personal belongings. At the end of the workday, scrubs will be left behind in the facility's laundry. Protecting employees from not infecting anyone at home or in the community is the proper practice. Necklaces, rings, or other jewelry should not be worn because they can harbor microorganisms. Lanyards, if used, should be left in the facility and cleaned on a regular basis. Basic attire should be worn in every area of the department and by everyone working in or visiting the department. See figure 6.3 on the next 2 pages to see examples of the proper PPE, donning, putting PPE on, and doffing, taking PPE off. The basic attire worn is as follows. Scrub attire should be changed daily, anytime it becomes soiled or as soon as it may have become contaminated. Scrub attire should consist of at least clean pants and a top. Some facilities provide long sleeve jackets. T-shirts, if warm, should be completely covered by the scrub top. No part of the t-shirt should be visible outside of the scrub attire. Note: some facilities allow outside visitors to wear disposable cover clothing, such as jumpsuits, instead of scrub attire. Scrub attire should always be put on, just prior to starting work and doffed, removed, before leaving work. Example: a disposal bouffant type head covering should be worn in all areas of the department. Head covers should cover all head hair except eyelashes and eyebrows. Reusable head covers, if allowed in the facility, should be covered by a bouffant cover to keep from contaminating the area with outside bacteria or with bacteria that may have multiplied on the caps due to improper cleaning. A bouffant head cover looks like a shower cap. That would be a perfect example. Skull type caps, only the ones that go around, are no longer suggested for use because they do not always cover all of the head hair. Beards and mustaches should be covered with an approved cover or to prevent facial hair from shedding into and onto items being processed. This is usually like a full cover mask. Sturdy shoes with non-skid soles should be worn in the department. Shoes should be able to protect the feet from items that may inadvertently fall from the work areas. It is good practice to have shoes dedicated to the area and not worn out of the facility. A cover gown or lab coat may be used to protect the scrub attire when leaving the department from another area of the same facility. This depends on the facility policy. Note: cover gown or lab coats are not meant to protect departmental attire while outside the building. Decontamination attire. This is when all individuals working in the decontamination area must comply with the dress code requirements for PPE. This is required by the Occupational Safety Health Administration, OSHA, and was established to help ensure workers are protected from potential pathogens. Risk of exposure to pathogenic microorganisms can be reduced by diligently following dress codes in decontamination areas. For example, fluid-resistant gowns provide protection from splashes that may soak into the contaminant area or through the regular scrub attire. An example of this is provided in picture 6.4. All of the basic attire outlined previously, except for cover gowns, should be worn in the decontamination area. Because of the nature of the work in the decontamination area, soiled and contaminated devices, water, and chemicals, additional attire is always required. See figure 6.5, which provides examples of PPE worn in the decontamination area. Decontamination PPE includes gloves approved for the decontamination area. These gloves are thicker than examination gloves to provide protection for the hands. They also have longer cuffs. Some are at elbow length, so they can be placed over the gown and cuff and to keep fluids from flowing into the glove or up the gown sleeve. A mask that fits around the ears and ties the head to protect the nose and mouth is required. Fluid-resistant gown or jumpsuit to protect clothes and skin. A fluid-resistant material will keep fluids away from the skin, while standard fabrics will absorb fluids, allowing the skin beneath the fabric to become wet and then contaminate it. Goggles or face shields to protect the eyes. Face shield will also protect the face, mouth, and nose. Note: wearing a face shield does not replace the need to also wear a face mask. Shoe covers protect the shoes from contamination. An example of a shoe cover: it should be worn even if the shoes are dedicated to the department use only, using boot length covers, which are not required but will help protect the leg area as well. See Figure 6.6, which provides a recap of basic PPE requirements and the reason each component is important. There is a proper way to don and doff PPE, which is also provided in examples 6.7 and 6.8, and give the proper sequence for donning and doffing PPE, meaning the proper sequence you should put on PPE and the proper sequence for taking off or doffing PPE.